Medicare, Medicaid, and health care. I proposed on April 9th, 2001. And that was very well received too. It involved one payer source and no paperwork. And the idea was that a doctor, when he treated somebody, he'd have a standardized card he receives from the patient, and then he'd run it on his phone or through his computer, internet site, and he'd type in the codes of what he did, and then he'd get paid right away by the federal government, either through a tax credit that he reduces his estimated taxes that he pays at the end of the month, or else through an electronic transfer. And I also recommended that for the states, that since each medical insurance policy is generally written exactly alike so that people can compare products, each state can have a one-source payment, with all the insurance companies being required to support that one payment source, so the doctor could dial out to that or use his computer to access that one source and scan the information on the standardized card for all insurers, and then a determination could be electronically made with a transfer electronically to the doctor's bank account. And this will save a huge amount of money. Doctors used to have one nurse and one doctor. Now they have one nurse, one doctor, and about 5 other personnel just to fill out the paperwork. So the doctor's offices will be hugely saving, and the medical costs should come down for that reason alone. The federal government's end of it, you fill out paperwork at the doctor's office, and then they have to read it and process it. And President Bush estimated that going to a paperless system like I proposed would save 21% on the Medicaid, Medicare costs to the federal government. Hillary Clinton, on YouTube, she has a healthcare talk she gives, and she recommended that my one-payer system be utilized. It's about 3/4 of the way through her 22-minute talk, but you can look that up yourself on YouTube under Hillary Clinton and see it for yourself. And you can compare it with my system, and you realize that she says that they were working on it for 4 years, and 2 years ago they estimated the average savings would be $100 billion a year, and it would only cost them $200 million an initial setup costs. So it's a huge saving. And if you take my healthcare system and apply that saving, you have room to have health care for a lot more people, and a uniform health care that doctors can treat people who would normally go to the emergency room of the hospital, and they'd have the same quality of care, and that's important. And so consequently, that's another thing that I solved, and Congress and the President appear to be going for. It takes a little while, but I gave them follow-on letters from April 9th to push them along, and it seems to be working. So that's